John, let's talk about professional households, right? I think that, my wife, who is a dental hygienist, and right, and I think the fun thing is like when the conversations have to stop, right? And when do they like continue on, right?
Well, sometimes I feel like I'm in a professional household with you on the podcast, right? Because it's like can we go out to dinner with our significant others and not talk shop, right? So our next guest that we have here, I think we're going to have an interesting conversation. And so we'd like to welcome you to the show. And so first, before we get into the nitty gritty of this, I'd like you guys to kind of introduce yourselves, talk a little bit about who you are, what you do, so our listeners can get familiar with you.
Well, I'm Jacinthe Paquette, a prosthodontist from Newport Beach, and married to
David Guichet. I'm a prosthodontist in Orange, and 1 day a week with Dr. Paquette at Newport Beach. We've been married for, 35 years?
36.
35, yeah.
Get that number wrong. I'm teasing.
That's awesome.
I was going to say, it's already a good way to start the conversation.
The counseling session today, John, has already started.
Just teasing.
So
Thank you for inviting us.
Yeah, thanks for coming on.
We're glad to have you, and we love the fact that we get to kind of vary up. We've been hardcore clinical for, a couple of days now, which is awesome. We love the nerd factor. We love to geek out on all this stuff. But we think this is a very interesting topic on what it's like to have kind of the dual professional household. What is that? What's the day-to-day like with that? Because we have, I think, as we were at the Young Clinicians dinner last night, there's a lot of young clinicians who are kind of maybe they have a relationship happening in their residency, or they're young in practice, and they're trying to figure out what that's going to look like if they were to get married, or maybe they are, and they're trying to navigate that world. And it's very different than, just having the one person in this world. Not only is it, there's so many aspects of that, from student loans to finances to the actual day-to-day. And we'd love to kind of hear your story about that. How did that start? And what does that look like day to day with you guys, especially in your clinical and professional life?
Right. Well, I have to say, thank you for the invitation again. And it is interesting to be talking about something that is not the nerd factor. And you said, what's it like? Well, I have to say it's awesome, because obviously we're very involved with our profession and professionally in various academies as well. And we actually have separate practices, which is the way we elected to do it. But there's a synergy there. And so with relationships that we have with people nationally, internationally, in the world of dentistry, we have just such a great time. So if we're attending a meeting, we're together having fun, meeting more friends. So it's fabulous. And we share thoughts. We don't talk about dentistry every day, but we do talk about it quite often because, it's interesting. So it's somebody that understands what you're doing.
I would have to say we don't differentiate. There's not a boundary. Like, I realize that many people would ask us the same thing, and I just said we're really parents more than anything back in the day. And so when we transition from discussing dentistry per se, we do have we cross that. We kind of say, okay, I have to ask you a question, or what do you think about this? But usually we just deal with each other as we would in a married relationship in reality. And occasionally that involves dentistry. And one of the benefits is that we both like continuing education quite a lot. Justine generates a lot of content. I generate a lot of content. And those are the little more stressful times that you got to kind of focus like a cram session. And yet the majority of the time, we're clinicians. We're just working. As we are now, at this point, we're empty nesters. So we have a little more of our own free time, and we can entertain and have fun and travel more than the past. But one of the things you said was, where did it start? How did it start?
Yeah.
That's right.
So the interesting thing is I was at UCLA. We were at the first day of dental school, and I was walking along, and I looked across, and I saw, oh, she's pretty. She and I would have a beautiful family. And at that age, I thought, this is a very unusual thought. I was 21, and I would always say, oh, she's a beautiful girl, or something like that. I would never think, have a family. And ironically, someone told Justine that I was a smart guy. And then she came and talked to me, and I was very nervous. And 2 or 3 years later, we started dating, right?
That's right.
Yeah. 2 or 3 years later.
Well,
Yeah,
actually, senior year.
Okay.
We were study buddies for a while, and then
Yeah, we were study buddies.
and then at some point something
Clicked.
happened, and we just it's been great.
I always like to say she was attracted to my appearance and me to her intellect.
Right. That's awesome.
So through those early years of, say, practice building, let's talk about that a little bit, because obviously, if you survive dental school and training kind of together in the trenches, that builds a strong foundation, because obviously you know what it's like to kind of go through, in a word, hell sometimes, right?
Yeah,
but
it's an all-out push.
It is. But there's a whole other push when you're out in the private practice world and building practices that are individual and separate, and the give and take with that.
I'm in agreement with you. That is an all-out push.
Yeah.
Surviving in the world of private practice takes 110%. And when your eye's off the ball, you're immediately falling behind, and the overheads are high, and it's a challenge. So I feel like being in private practice keeps you sharp on your toes. During COVID, the one thing we did learn is that maybe you don't have to be so hyper-focused.
Yes.
And, think smarter and don't necessarily work harder. But I think Dr. Paquette's always been effective as a clinician, thinking smarter, and I take her lead on that once in a while.
There's some great business books out there that talk about, that we can only do 3 things well, right? And being business owners ourselves, and starting private practice from scratch myself, and you taking up a family business there, is the E-Myth says that honestly most small businesses don't survive. And in the world of marriage too, we're living in a world where marriages don't survive. Greater than 50% of marriages just don't survive in the United States. And you guys are making things work. And so in that E-Myth book, it talks about you can really do 2 things pretty well. Most people can. 3 things pretty much impossible. There's 1%ers out there, obviously, for every rule. And so you can be a technician, you can be a visionary, right? And you can be a manager. And so, like I said, you can't do all 3 things. Some people can do 2, and most people can do 1. Dentists are obviously, if you're wet-fingered at all, you're a technician. Speak to that. I mean, you mentioned during COVID even that you've kind of refocused maybe to work smarter, and not harder. Are you delegating more now than you did when you started?
Well, I'd like to address this one.
Yeah.
I think what you said, when you said you're a technician and a visionary and a manager, I like to think of myself as a technician and a visionary, in that we're constantly trying to innovate in our practices.
That's good.
And less so in management. I have partners that fill in the gaps where I am not as strong in that area. So we're looking to link digital workflows for practice efficiency and fully leverage our practice based on this. And that practice model has been in test for 5 years, and it's really turned out to be true and effective. Basically, I talked a little bit about it today. One of the most transformational changes in the last 10 years for us was the intraoral scanner, not as a treatment tool, but as a diagnostic device. So we get that information on every patient in their first visit. And I had to fight a little bit of an uphill battle on that, in that it's a cumbersome device. It's hard to move around. And until we had the infrastructure where it was light, easy, quick, upgraded infrastructure digitally, upgraded, IT. And then all of a sudden, the efficiency phase came along. And now it's just like the staff is getting the scans, boom, 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 boom. And the practice efficiency and effectiveness and comfort to relax and know I've got everything I need and have it all there, the lab support that they know how to use it. We had to push to get it there, but now it's really achieved a transformative effect in our lives and our practice. So
it's funny because for me, I think I'm more the manager technician side of things. For us with 3 grown sons now, it's obviously management of the family was an emphasis that I had, and management of my entire team and our practice. And it's the beauty of having a dental practice is a continuum in that you continue to strive to be a better people manager, a patient manager. Those are the things I really enjoy, and obviously the technical side as well. So definitely David is more the tech guy in the and technology as well. And for me, it's more the management side too. So it's interesting.
Do you guys run your practices, do you feel like completely differently, or do you feel like you run them in a similar fashion?
I would think differently. I would think that the parts that we have most in common are patient care. And at the highest level, we are both dedicated and focused on that. But on the management side, I surround myself with technically expert staff that really have our back. And Dr. Paquette, I believe, has a vision to know when to step in and say that we need to take the reins and take a look at the way this is going, and let's do this or let's do that and let's make a change. And rather than work with it. And I hire people who are effective around me at helping make those decisions.
I think delegation is really important because you can't be everything, can't wear every hat. But definitely who you surround yourself with is important. I'm sure you've heard this from many business owners that you need to have people that are just as dedicated as you and people that are skilled. I have to say, having been in practice now 35 years, that we have a team that is really just fantastic. And we hear that reflection from patients all the time. So it's a great thing to get to that point. And
Justine, you have a quote that you often say, you're most like your 5 best friends or the people that you...
Yes, you're most like the 5 people you hang around with. But also it's interesting because years ago I wrote this little article called The Second DDS. It's one thing to get that DDS degree, but the second one is then to develop that practice, deliver quality, right, and exceed expectations and so on. So that's the fun part of it. That's the part you can enjoy with doing the dentistry. And don't sway from that vision. Stay the course. It may be enticing to maybe compromise your objectives at times because of financial strains, but really having that vision, what your practice you want it to be, you can create that. And so,
what do you say to people who are in where you were when you were 21 to 25 years old, before you were married, who are looking at that maybe, and they're saying, well, I think this is the person I want to be with, but say again, 2 professionals. What are some of the questions they should be asking? What are some of the challenges that they should expect to face? What would you advise them to really look into before making those decisions?
I think you have to have someone with a similar culture. For me, the thing I appreciated about Jacinthe was that she was a talented person, but also ethical. All the decisions were high core value, ethical decisions, not necessarily religious ethics, but actually the core individual, it would make the right decision all the time. I always say she's a multiplier. People get near her and they do well and better. And I mean,
That's
it just
nice.
has a tremendous...
That's pretty huge.
She's an influencer.
No doubt. No doubt.
Well.
It's true. She's had a tremendous impact on our kids, too. As a parent, she calls it steering.
Yes.
I call it steering maybe, but she's in fact the puppet master in that she can help those guys make the decisions that are important to make at the right time. And as a result, I think they're very successful kids too. So
now some people say that you have to make a decision sometimes as a parent between your career and your family, right? Some people say that. Now, what I'm hearing from you is that you would probably not agree with that.
I completely disagree.
Yeah, talk about how you
Completely.
implemented that. How were you intentional about balancing career development and family development? Talk about
families first. I mean, I think that there's just if we both believe that. So there are times we would make little sacrifices. I thought to myself on occasions, if I would just be over there, I think I could push forward and make these relationships happen, and I could move in that direction. But always, Justine would steer us toward the family and say, "Hey, look, we're gonna do this or we're gonna do that." And I couldn't deny it, So since we were in agreement,
it's really quality time, not quantity time. And obviously with my sons having had a mother who's obviously very professionally busy, I think that they're extremely independent. And, I think some young women may be concerned that they're not giving their children enough time. It's that quality time that really counts. And I really think it's an asset for them to see a working mom, if, any form of working, whether it's in the home or private practice or whatever the case may be, but somebody who is fulfilled and engaged. And personally, I know that the interactions that I have with patients, I always thought about what do we want to encourage them to be for their futures. So it's kind of a luxury to be able to talk to patients in whatever their career path they had chosen, to kind of get their insights, to maybe discuss it with my sons and expose them, to assist them with their decisions for the future too. So
I think, some of the things you're saying there just ring clear to me is that you've established core values in the beginning amongst the two of you as a husband and wife, and you agreed upon certain things that are beyond dentistry.
Knowingly or unknowingly, I don't think we had a conversation
Sure.
today and said, when we get to the future and they're going to have this decision, we're going to go this direction.
Right.
It's just that we were attracted to each other, and that if like steering, you kind of know this is the right decision and this is not. I would say that the children did not, they were not without good role models in that we knew how to work. If one thing, we would lead by example in work ethic. We have an expectation that there are times where you say, well, maybe it's time to relax or it's time to work. We would get the job done. And so they would maybe, I think that they could reflect on that for their own lives.
yeah.
Now, being that they're grown, how do you see that reflected in the decisions that they're making at this point? How do you see, did the work pay off?
Absolutely.
It did pay off. And I guess part of that equation as well, because I know it's difficult to be a parent of young children, and you worry about where they're going to go to preschool, then elementary school, then high school, college, etc. But it's always kind of being behind the scenes and placing them with the right peer groups and right, as best of an arena as possible. Part of it is luck. I mean, I don't want to say that, this is all our doing, because certainly we try and not puppeteer, but control as much as we can.
You did say puppeteer.
I'm only saying that because he keeps saying that about me.
Oh, you heard that? Okay.
But no, it's having, just being mindful of where they are, trying to expose them, guide them, and prepare them for the future. And our three sons are happy with their professional choices, and now moving into relationship choices. And so they're flying solo now.
Certainly there's stages of a marriage and a business, and you guys are moving into this next stage in your business. And, I'm in a stage of business of kind of in this growth phase. John's in a similar situation, and we're all making decisions based on where we're at. And as you move into whatever stage you're moving into, how is that going to, you're practicing here, you're practicing here. What is the next thing? This idea of I'm going to cut back, right? And then the work-life balance, where does that line up?
Yeah, and I think I'm picking up on what you're saying. Does being an empty nester to you mean that, I want to actually, okay, I've kind of gotten my kids through, I've gotten them into college, whatever it is, and now I want to maybe do less? Or does it tell you want to spend more time together? Is it you really want to now be able to do things professionally that you maybe were having to maybe hold back
Content
a bit because
generators?
What is that going to look like?
Well, first of all, I've got to compliment you two on your professionalism. This is quite an engaging conversation. But for us, this has been a matter for me. I've decided that I would stay healthy and young as much as possible and contribute as best I can to health and wellness and fitness, everything in moderation. And I read a book, Younger Next Year, and that one has had a big impact on me, and I try to go along with that. And I think in our professional career, we're cross-pollinating. We take the best of each practice and say, we're over this and we're over here doing this. So Justine eventually has that, and then they have areas that we're like, oh, they're doing that. So our teams are kind of in a quasi communication, and we're reflecting upon each other. So
that's really powerful.
Yeah,
it is amazing.
That is very powerful.
It is. It's interesting. David's strengths and area of focus is somewhat different than mine has been. Mine has been very much aesthetics, etc. And so now that he's coming into our practice, I never imagined that we would be practicing at times in the same office, but it's really been a wonderful asset, and he's able to bring to our practice something, that another dimension that maybe we were lacking in.
Yes.
So sometimes you plan these things, but sometimes things just evolve on their own, and that's kind of what's happening now. But throughout that whole process, now what is 35 years of practice for each of us,
I would say convergence and synergy. Our lives are converging, and we're fairly synergistic and having some fun.
I think for everyone, you want to try and have a balance as much as you can.
Yeah, a similar situation happened in my relationship with my wife. Is we pulled back in COVID and went into where we weren't practicing for 8 weeks, and she and I decided that for just lack of a better thing to do other than spend more time with our children, we wrote things that mattered where we get the glasses out of the cupboard. And we had our kids list the same things, and we said, now we're going to eliminate some things. And then what we did is we also spent more time together reflecting. And then after that, I said, I'm going to need you to support me in this next little bit because we're unsure of what's going to happen. And she rolled in a big way, and knowing what she knows from being in dentistry, was able to come back at a full-time manner for about 10 weeks. And what that did for our practice was it brought back some perspective that both of us decided when we opened up from day one that I felt like that we lost. And our team saw that, and they got behind the vision of what we originally created because I brought her back in.
Yeah.
And I think that's the power of like this dual professional thing, is that we complement each other more than we know because we're at home, and you become who you're around.
And it's definitely mutual respect, I think, is what you want your children to see, your team to see.
Absolutely.
It's respecting that other person and saying, hey, you are excellent at this, and they feel the same about you. And I think COVID hopefully has had that effect on a lot of us, to sit back and go, okay, what really matters? What really doesn't? Again, it's great to produce and collect. That's a beautiful thing. But there's also time, and there's also passions, and there's also the people side that I think.
And how you relate with your team.
Absolutely.
As well.
It was a forced slowdown that allowed you to kind of refocus back in and potentially stay on that course.
That's right.
Because I know there's some clinicians that focus on, quote, slow dentistry.
Yes.
And that's the most enjoyable dentistry.
It is.
And that's the most, longing dentistry and relationship and loyalties with patients as well. So I think that was a good heads up for us to experience.
Thank
it
you.
happened collectively.
I really appreciate you guys coming on and talking about this subject. It's something that isn't really discussed much in even on our show, John. We focus on the clinical and a little bit on the business as well. But I think that you guys bring something to the table that's pretty special.
Yeah,
and
enjoyment of life, when we are in practice and at home. And I think what I've certainly, realized, and again, this is like, we're getting very personal right on these things.
I know.
But, that's what it's supposed to be.
Okay, John.
But it's
I'm more of a filler than you.
I know. I'm trying to become more of a
He's an analytic.
Yeah,
right?
that's true. But, you start to understand that, when in the end, what is going to matter. And if you are happy at home, then things tend to just kind of work out and at work. Yeah. And I think that, we've certainly met a lot of people that through COVID, it was, very much exposed that things weren't always good. And, I think it's interesting, and this is, again, it's just hitting very close to home for a lot of people in this building, but, you can look at professional development as a way to sort of escape from things that aren't great. Or you can work on making things at home excellent. And I think if things at home are excellent, then it kind of just filters into the rest of your life.
I got to ask one clinical technical question, right? These are prosthodontists. They practice at a very high level.
Periodontists and prosthodontists.
Yeah, periodontists, prosthodontists. They practice at a very high level. Obviously in aesthetics.
Both pros.
Yeah, both pros. Yeah, so aesthetics and all the things come into play. I would say, what is your excitement at this point in your career for next level dentistry?
Next level.
Yeah.
Yeah.
What's
You mean what's the next disruption?
Yeah. What's the next disruption? You brought in digital scanning
Well,
5 years ago. What's happening?
Yeah, okay. So what I think is going to make a difference in the future on patients that have high demands, not high aesthetic demands, but high clinical demands, is that we're going to have an assessment tool, something to assist us in getting the diagnostics done very efficiently. Templates, templated process where our digital data collection and our clinical data collection is at the highest level and standardized and quick and efficient. And so as a clinician, we'll be able to make the appropriate diagnosis based on the most appropriate data collection. And you could see it happening in medicine where there's some new age medical community and they'll say, come in, we're going to do a digital analysis of you.
Yes.
And but I think in dentistry, we could do it very efficiently and very effectively. The tools are there, and we may not know all the tools that might be coming around the corner.
Right. Yep.
I feel like we've already pushed ahead in this arena a little bit, and I
Yes.
can see the next level. I think it's just out there. I'm not sure that I've got a handle on it
Yeah.
exactly.
I think we're there. It's just a continued refinement.
Someone's got to piece it together right now. Consider that
Exactly.
Uber came around as a result of GPS and financial technology on the phone.
That's
and
right.
Those convergence,
Yep.
if you have technological convergences, all of a sudden you have opportunity. We don't know what it's going to be.
I love when things are repeated because when things are repeated, typically
usually
it's
something to it.
something you should turn your head out. That's why whenever we look at clinical evidence, when it's repeated and it's the same thing, the same results, it's like, maybe we should consider that. And
Right.
so you've said something that's been repeated many times
Right.
already.
We keep hearing the
and
same
we
thing.
keep hearing this. And we've heard Dr. Greg Kinzer talk about that,
Yep.
Dr. Bob Winter. We've heard Dr. Christian Coachman talk about that on our show.
Really?
And,
Yeah, just today.
Just today. And I think that it's something that we need to listen to more is our diagnostic data collection and having a place where we can put all those things
Yes.
and do it in an efficient way. We have the technology here.
Yeah, I feel like, this AI where when we drive the Tesla on this full autopilot, it's identifying humans, it's identifying cars,
Yes.
cones.
Yep.
I feel like we can get a scanner and it'll identify existing restorations and
Oh, yeah.
mountain sports,
Yeah.
and it'll be able to identify
coming.
them.
Oh, yeah.
And then
Well,
we just...
Coachman was
corner.
just talking about the idea of, scanning a patient at every visit and developing not only a history, but also a projection forward of what this edge wear will look like in 10 years, for instance, so that we can then, educate them and then take it from that and say, well, could we even go back to where you were 10 years ago because we have scanning
Absolutely.
from 10 years ago and recreate what we had. And so this idea, like you say, of getting that data and then AI taking over and projecting forward what's going to happen if we don't, rather than us just saying, well, if you don't do something, one day we'll need veneers. Well, what do we just show that? Could
Right.
AI do that for us?
Very interesting.
That could be
Yeah.
talk about disruptive. That could change
Well,
things.
time.
thank
Yeah.
you so much for coming on and
Absolutely.
talking to us.
Thank you,
and-
gentlemen.
Yes.
Thank
We're
you
happy
so much
to
for the
have
invitation.
been able to contribute.